Hi, I'm Kimo Hinton.
I'm Jocelyn.
And our project is on ALS. There are three formal names for it. You have ALS, you have amyotrophic lateral sclerosis, and formerly known as Lou Gehrig's disease. It is a disease that affects both your brain cells and your spinal cord. There are neurons that run from your brain to your spinal cord, which then run to your muscles. When the motor neurons die, the ability of the brain to initiate and control muscle movement is lost. Patients in later states become totally paralyzed, and all of them end up dying. So let's break down amyotrophic into three parts. A, in the Greek meaning of negative. Myo, meaning muscle, and trophic, meaning no muscle nourishment. When the muscle has no nourishment, it atrophies or wastes away. After those neurons degenerate, they can no longer send waves to the muscles, which then result in no movement. Symptoms include increasing muscle weakness, especially in the legs and the feet or in the arms, speech, swallowing, and breathing. When the muscles don't receive messages, they begin to atrophy or become smaller. Limbs begin to look thinner as muscle tissue withers away.
So here we have a diagram of the normal cell and muscle and the affected nerve cell and muscle. So you can see the axon and the muscle are all full and complete and nothing is damaged. And then we have the affected ALS nerve cell. You can see how the axon begins to become thinner and the muscle becomes smaller, and we have the cell body which becomes damaged as well. Some causes are due to genetic effects, other times it's unknown. In ALS, nerve cells waste away or die and can no longer send messages to the muscle. How do you determine if you have ALS? Tests that may be done include blood tests, reading tests to see if lung muscles are affected. We have cervical spinal to be sure there is no disease or injury to the neck, genetic testing, swallowing studies, electromyography to see which nerves or muscles do not work well. Is there treatment for ALS? There is no treatment known for ALS, but there is medicine called Riluzole that helps you slow down the symptoms and live a little longer. We have physical therapy, rehabilitation, use of braces or wheelchair may be needed to help with muscle function and general health. A nutritionist is very important. Patients with ALS tend to lose weight. The illness itself increases the need for food and calories, but at the same time, problems with swallowing make it hard enough to eat. We also have choking for being a common thing. Patients may decide to have a tube placed into their stomach for feeding. There is also breathing devices, which include machines that are used only at night and constant mechanical ventilation. There is support groups for emotional support. Groups such as ALS Association may be available to help people who are coping with the disorder. And there is some research being done to find the cause of ALS and to understand the mechanisms involved in the progression of the disease. Scientists are trying to find what triggers the motor neurons to degenerate in ALS.
So there's some percentages that we found up on the internet. More than half of the patients live more than 3 years after their diagnosis. About 20% live 5 years, 10% live more than 10 years, and sadly, only 5% will live longer than 20 years. So, some notable names that we all know that have been diagnosed with ALS are Lou Gehrig, as I mentioned before, Stephen Hawking, and one that maybe everyone might not know, Pete Frates. He was a college baseball star who was diagnosed in 2012. He is credited with the creation of the creator of the Ice Bucket Challenge. This is both to raise awareness and money for the ALS Association. His dream was to play on Fenway, which, as we all know, is Boston Stadium. So they did the Ice Bucket Challenge for him in left field, and the joy on his face was just priceless.
So this concludes our video, and hopefully you guys are well informed about ALS.
Thank you.